Health is up first.
Right.
You
I'm
were
gonna
the
let Sarah
topic in
do-
the address last night, governor's address.
Yes.
How exciting for us.
Yeah, and with all these changes, who knows if this is really what it's gonna be, but, this is
Yeah.
what we're gonna present today, and then we'll go from there.
Okay.
So I'm Sarah Lucas, and of course all of you know Annie, and we are with the BHDS department. So today our presentation really covers 5 buckets. We all know about the MHDS component of our budget. It is our largest, also known as Fund 10. We also provide and oversee the preventative and treatment part of substance use, and then we oversee a small part of a collaboration with our network providers called the Positive Behavior Supports. New since July, we are now engaged with the CJCC and also the opiate settlement. So we've hired 2 staff to go with that. So that's kind of just a general overview of what we'll be chatting about today and what our numbers reflect. So on slide 2, that's okay. On slide 2, we have our budget request. So our estimated revenue is at about 22.3, our expenses 24.2, and that includes our decision packages that we'll be reviewing today. Currently, we have 11.1, or I'm sorry, not 11.1, 11 FTEs. Let me get that straight. We don't have 11.1 million FTEs. So as we go to slide 3, we are looking at our revenue estimates. So we are growing about 2.1 in our revenue estimates. 1 million of that is our opioid settlement money. The other part of that, the 1.2, is our MHDS state regional government payments. We moved from $40 per capita to $43 per capita, and so that allows us to have that 1.2. That is additional revenue. Questions with revenue?
The opioid settlement, without getting into too much of the weeds, what are the restrictions on that?
Those dollars have a specific exhibit of services that we can provide through it that came through the court system, and so it's a pretty long exhibit to explain everything that can be done with it, but basically the individual has to have an opioid use disorder or be at risk of that for certain parts of it. So it can cover anything from preventative care to treatment services.
Specifically to opioids, though, right?
Specifically for opioids.
Yeah, that's what I figured.
Mm-hmm. So we've hired an individual, Gabby Ruggiero, who has started about 4 weeks ago. She is collecting all the data right now, putting together a strategic plan. We're using the sequential intercept mapping that we did through the GAIN Center to do part of our strategic plan, but we also, that looked at just adults, and it didn't look at prevention, so we also need to add a piece about prevention, and we need to look at our youth. And so Gabby is pulling all that together. We'll be pulling together our stakeholder groups. We'll be creating an advisory committee for that. So there's a lot of work to be done before we start spending money in that area.
Right, thanks.
Mm-hmm.
Any other revenue questions? Okay, let's move on to expenses. So overall, our expenses went up. So what that means is when you compare our July amendment to what we're submitting for our 25 budget, there's a $3 million difference there. So we've already talked about opioid expenses being new since July. We've talked about the CJCC being new, and the 1.2 million that is increased revenue from the state for our programs. Back in July, we knew that we were going to request an incentive fund request, so we were going to ask the state for extra dollars. We had submitted that, but we didn't know the outcome. We now know the outcome, that we have received it, and so we will have more money than our FY24, or than our budget reflects from July. When we put together our 25 budget, we could only put together how much revenue we need to submit a balanced budget. So what we're submitting for to the supervisors is that balanced budget. We get 1.2 million more in Fund 10. We're going to spend 1.2 in that. That doesn't capture need. We're about a $7 million gap in what we need versus what our revenues have. You know, if that incentive fund practice is still available. We will do that for FY '25 as well to try to get our needs met. That $7 million gap consists of our new objectives. It also consists of restoring housing support to where it was from like pre-COVID, I don't remember what year. And then there are the most of that is 4.6 million in IDDD expenses, because we're one of the few regions that does support IDDD folks, and the state has indicated that yes, that's something that they want us to do. So, so those are kind of the high-level opioid pieces, and then the other piece to that 3 million is our decision packages, which we'll be discussing. Any questions on expenses? So slides 4, 5, and 6 outline, 4 and 5 outline the individual line items from that budget request that we submitted.
What's the living arrangement increase?
From in the gap
Expense
document?
request.
Oh, so it is primarily when we looked at utilization, part of that utilization was there. And then when we looked, the living arrangement would also, I think, contain that permanent supported housing as a support function, because it's in that category. So a piece of that is our permanent supported housing, and as well as just utilization. So it could be, not 100% of the particulars, but I'm betting it's like SEL, permanent supported housing, Meals on Wheels. Those are types of that support function.
And that went up almost $300,000.
Right, but you have to understand how you know how complex our system is. We're really looking at a balanced budget of 24 compared to a balanced budget of 25. So it is, when we budgeted for 24, we took all of the budget and we just did straight across the board cuts. So when we did that in our initial 24 planning, when we did our amendment in July, we shifted it based on expenses that we had through June 30 of 23. So we're not reflecting true need. We are reflecting utilization in two balanced budgets that doesn't really reflect need.
It's really.
I'm not explaining it well, because you've got this, what the heck's there? What are you trying to say to me? But
You do totally different than what we normally do.
Correct.
Yes.
Which you guys always do, and you really screw up with our heads.
Yes,
don't mean to, but yes.
it's very true.
I mean, you're not even showing, the true budget here.
No,
Well, Deb, did you copy this? Okay, well, I'll forward this to you, and, actually, I'll share it. What we did when we were, meeting with Ron and Sarah is that we did a overall review of, Fund 10 and what the balanced budget has included in it versus the overall budget, and then this is the detailed budget for all of the different components of the budget.
So you just run off those for all of us rather than just passing around, right?
Yes, yeah, it's all, I hate to say it, but it's a shell game because we meet the need of the clients first, and then we arrange the budget so that it reflects what the client needs are at that point in time. So it's what was utilization at the end of July, or at the end of June that we reflected in July. We used those July numbers to forecast FY '25, and then we backed it down from 28 million to 21 million. So, yeah.
So we're still short. That's why we're short $7 million.
So that's the part I don't understand, because I'm glad they're confused, because I'm confused. $7 million of need, how does that show up?
So it's 4.6, that's fine.
Rather than passing around, why don't you run copies for us, or somebody can, I
Oh,
mean.
sure, yeah. So 4.6 of that 7 million is, touch over here. So 4.6 of that is the IDDD expenses, right?
Okay,
So, Polk County is one of the few regions that funds IDDD services. And so, that's one of those easy-to-track explanations for a bulk of why we run over our per capita amount. So then, another set of I don't remember the off total. Do you remember what our new strategies were? I'm thinking it was probably,
Last year?
no, for 25. I'm thinking it's about 2.5 million or 2 million. And so that's like, we want to work on paramedicine, we want to work on some cultural competencies around educating our community about disability services. We want to.
You mean these are new strategies that you want to work on? So going back to Matt's question on that, you're saying we're short 7 million. We haven't done the IDD because it wasn't allowed because we didn't have any money, even though we're supposed to be working on those people?
So for FY25, or FY24 currently, we are serving IDDD folks.
Okay.
Our incentive fund allowed us to continue that through June 30 of 2024. So IDDD folks are.
Handled. We took care of them.
For this current fiscal year, yes, there are no budget changes.
Okay.
For FY25, we're proposing on paper that we cut those expenses. At the same time, we know that the state values us providing IDDD services. We will include that in our incentive fund application to continue doing that.
So you're playing a shell game with the state.
Correct.
So you're showing it as a need with the expectation that it may or may not be funded.
Correct.
With the
But-
incentive funds.
Correct, because
Well-
we have to submit a balanced budget.
Got it.
And so we have identified the areas that are easy for us to track and that the state wants us to provide so that we can then ask for incentive dollars where they will most likely give it to us. They did last year and they tell me that it's still there for this year, this coming year. And then we can get that money from the state. Then we have to submit new information to you guys because our budget, we get more revenue. It gets really complicated. And then we report to the state how we spent that incentive funds.
And you're gonna spend it with IDD for IDD people.
ID for
And-
housing, because we want to
Housing.
increase housing.
Right.
And
OCR.
some new, OCR, the Outpatient Competency Restoration, the program that the state said we had to do. This year we did IRSH, and so they gave us the money for that. But this next year, there's a few new things that we want to do, such as the community paramedicine to help with our firefighters who are going out and seeing people. And so those items we will not implement unless we get incentive dollars.
Enough money from the state.
Correct. So IDDD and then all of the
But
new.
once again, it's a shell game.
Yes.
And what's the time on the incentive funds? Don't they run that out?
So we can apply at any time before November 1st of the fiscal year that you're in. And then we will know, I think we got the money in November because we submitted so early. So the latest we could know is January of the fiscal year that you're in if you get money for that fiscal year.
Are those incentive funds still sourced from what's being turned back in by the regions? And
Yes.
so what budget cycle do you think the incentive funds run out?
Well, with what came out this week, I would assume that after next fiscal year, they're going to revamp how we're funded completely.
Yeah.
And we'll have to do the RFP to see if we can be one of the administrative service organizations. I have to always remember the new acronym, and ASO. I think she was calling them districts last night. So we would have to apply to be one of those, be accepted. And then it sounds like, from what I've read, they're going to no longer do the per capita, and instead they are going to give the money based on need of that area.
Will there be
So-
about 7 districts then?
That's what they're proposing, is 7 districts.
6. Oh,
Six.
yeah, 7 districts,
7
you're right. Yeah,
districts.
we're 6 counties. We'd be at one of 6.
Correct.
So that incentive fund's kind of been our lifeline for a few years here, but they're gonna have to either increase the budget for mental health services or.
Some of the other ASOs or districts have extra money, and some of them don't. And so I think by doing it instead of per capita, by taking all the money and then dishing it out based on where where the need is, that we will, I think it should come out to be okay with the amount of money that they have in the budget right now.
It says the incentive fund currently has $23 million in it, almost $24 million in it.
Correct.
What you just said, I don't believe is really gonna happen. I mean, it says we're gonna have the same access to the same set of behavioral health services, but I just don't see how that's gonna really happen with us joining with 5 other counties.
Different needs than we have.
Yeah, so we're gonna establish a new structure, a function, a new governance, and authority under this new ACO, Administrative Service Organization.
Correct.
Okay. Wow.
As a positive, Polk County has, Polk County has all the core services, or we have made memorandums of understanding for those services. So as far as meeting the core service need, Polk County sits very well. And Polk County responded to the ACR, the outpatient competency restoration ask that they had. We performed very well, and I think they were pleased with how Polk did. So I think those are assets and strengths for us to support our ability and capabilities to be an ASO.
They also are they want to see performance-based outcomes, which we already do, and they're modeling it after what we do. So that's another thing that I think is a positive for Polk County as
I need
becoming
one
the
more.
ASO.
I've never doubted that we don't do the core services and we do them well, because, I mean,
Of course, you've been one of our biggest supporters. This board is.
that's what they say. The state says, follow what Polk does. They say it quietly, of course. But for us to join with other counties, I just,
I know, that's gonna be tough.
okay, I'm not gonna say anything else because I'm probably already in hot water with her, so. Whatever. Okay,
So to get back to Matt's question about the 7 million, really the 4.6 million for IDDD are the only current services that are being impacted as we move forward. The OCR is supposed to be budget neutral because all of the regions put in together so that it's basically like a cost settlement and it doesn't harm Polk even though we're the provider. And, yeah,
So we're in Plan 24 year right now, and we have those services funded. We're reversing that funding for Plan Year 25 with the hopes of getting the incentive funds for the replacement of the 4.6 of IDD.
there you go.
Correct.
That's what I wanted to say.
Thank you.
What he said.
yeah.
I think we did
yeah.
last year, and of the 7 million that we're short, 4.6 is the IDDD, right?
Yes.
Correct.
So the bulk of it's that, and that's one that's being served now. We'll continue to serve, I'm sure, but that's at least 2.4, I guess, right, that we need to worry about.
And in the future, they have said throughout all these documents and through the presentation last night that IDDD services will move to ADRCs, which is, that's an acronym for Aging and Disability Resource Centers. We have one in Polk County, but it really focuses on aging and doesn't really do much with IDDD at all. And so it's gonna be a big lift for them to learn what all that entails. And so the state has said that they know their ADRCs are not that strong, and so they're going to be opening that up for others to apply to become ADRCs and to be able to manage the IDDD along with aging services, which I think would be a big benefit for our community.
But that doesn't happen overnight either.
Nope, it does not. But that's the future. That's where they're moving towards.
So the AAAs would be then, the aging agencies would be part of this mix. There's 6 of them.
Correct.
And would the overlay be identical then between the AAAs and the ACOs?
So the plan is, from how I have understood it, is that the ADRCs will contract with the aging, the AAAs, to provide the aging portion of that service that falls under them. So look at it kind of as the ADRCs are kind of like the ASOs of.
A lot of acronyms she's flying around.
So ASOs are the new regions, and they will take care, so our new role will be tobacco, substance use, and mental health. So that's the ASO. And then the other group is the ADRC, which is Aging and Disability Resource Center. And they will do what we do, only oversee ID, DD, and aging
So
services.
we won't have anything to do with that anymore?
If we are not at ADRC, we will have nothing to do with that anymore, and our providers will be on their own under that umbrella.
Holy moly.
So that's, those two things, they're
Substance
splitting.
abuse and tobacco, that's what we get? Okay,
Yep.
we'll start smoking.
No, our job is to get people to quit smoking.
I got it. Oh, wow, okay. Where are we on your slides?
I have
Well,
no idea.
Well, as we circle back to the 4 and 5s of expenses, the only real number in there is the detox emergency care treatment decrease of 188,000. We are paying 13 months of bills for Broadland's detox this fiscal year. Next year, we'll drop back to 12 again. So that is basically a month's worth of services.
Okay,
So then we move on to our decision packages. I'll turn that over to you, Annie.
All right, so we have 3 decision packages. The first one is the pretrial release program. You guys all know about that, so I'm not gonna go into detail, but that is the first row. The second one is MHDS Research Analytical Services. Basically, this is our IT person that we currently contract with. It's, you guys had said you would like to bring that person in-house or bring that service in-house instead of doing a contract. So we are working on that right now, and that is really cost neutral because we're paying for that out of our budget through the contract, and creating a position within Polk County. And then the last one is kind of a jumbled mess. It's to redesign our office to meet the needs of sort of the new world of alignment, but we don't know quite yet everything, so this is just a start of changing.
placeholder?
We need to do some of the changes now because we have several people retiring this week and in a few weeks, and we have another person who's gonna be moving out of state in a month or so. And so we need to do some reclassifications and that sort of thing in order to better align ourselves for our future. And so I do have a handout. If you're curious. This talks about all the different positions that are within our department. Along with on the second page, it really just kind of shows where we're reclassifying. If you guys are okay with all this.
John Norris needs one.
I got it.
So, we have the CJCC coordinator, and then the 2 pretrial release positions that are currently vacant. We have our program planners. Maria's position will become vacant when she retires this week. And so we are gonna hold that one vacant for a little bit until we figure out what's going on exactly with the state. We currently have Sarah, who does our budget. Liz Poles is our coordination specialist who works with our families and with our clients in the community. We would like to take Diane's position because she's retiring at the end of this month. She has done our budget, she's a budget coordinator, and we would like to reclassify that position at a lower pay grade, I think.
No, it's the same.
Same pay grade, sorry, as a budget and compliance coordinator, because we're gonna have to need more oversight for contracts and outcomes in our future. And so, to take it more into that world and that angle, rather than just strictly budget. Create the new position for IT/database, which will replace our contracted person that we have right now. And then reclassify our office generalist to create a CSN coordinator. CSN is our data system that we use to track everything that we do with the state. And we just need somebody who can focus strictly on that and being able to do all of our outcomes. And because we have a lot of outcomes we have to report to the state now that we didn't have to used to do. And so reclassifying that office generalist to this new CSN coordinator. And then we have Pete and Colin in the central accounting. And then this last one is the one that is an iffy.
Is what?
Is iffy. Because our providers have asked us to use some of their incentive dollars that is budgeted through MHDS funds to create a position of a social worker who can be, who can assist our direct support professionals, so all of our frontline people out in the community for all of our provider agencies, who can help them find, basically be a social worker for them. So they need help finding daycare, then the social worker will help them so that they have time to be at the job and do their job and not have to think about some of these things. That, because of the changes that the state's making and moving IDDD out from under us, I am leery about doing this, but I want to have approval if things should change or do differently, so that we can move forward with that, because all of this is funded and fits under Fund 10. It's all budgeted, it's budget neutral. We have the money in the budget, so, just throwing that one out there is, it's
So
more.
this person would be focused just on the provider, frontline providers, not clients themselves?
Correct.
So it's fairly known universe.
Yeah, so like we had, one of our DSPs, actually their, parent came down with Alzheimer's, and they're like, I don't know what to do. And so they were trying to do all of, like, figure that all out on their own while they were trying to do the job, which is a hard job, where they need to focus on the job instead of on all this other stuff. So that social worker would be able to do that research for them, give them the information that they need. So just to kind of take the weight off of our DSPs, they're already underpaid. They have 2 or 3 jobs, some of them do. And so just to give them support in the social determinants of health that they need help with. So if they need help finding health insurance, then we would help them work through that with them.
How many people is that, do you know?
Oh, how many DSPs do we have?
I don't have a good wag on it.
I don't either. Thousands,
What's that?
thousands of DSPs at all of our agencies.
It's not just 10 or 15, it's like lots.
Mm-hmm.
That's pretty good to say that. All right, thanks.
Mm-hmm. And we really wanted someone neutral that isn't within one organization, so that anyone can feel free to come and utilize their services.
That's really expanding your service.
It is. And this is, when we decided to switch out how community living incentives are given out, this was one of the things that the agencies asked for, was if we could be the neutral party that would hire that individual to be available for all of their employees
As a navigator.
as a navigator.
So, back to pretrial release, where's that, on that decision package, that money at 255? How is that gonna be handled? Is that,
I don't know.
is that new money that we're putting in as the county then?
Yeah.
I
Okay.
believe so.
And that will hire the 2 positions?
Yeah.
Okay.
Right. And then we,
We're no longer gonna be paying the $240,000 that we were paying annually in sheriff's budget to provide those services, so it's almost a wash.
Okay.
yep, and then we're still in meetings with the state, but the rental income, we should be able to retrieve north of $60,000 in rental income from the state too.
Okay.
That's the plan.
So it should be about a break-even proposition is what you're saying?
I think to be fair, probably can't say it's gonna be break even. But we're trying to minimize the costs, so it could net out 50 to 100 more.
Okay.
Is that the right number, Sarah? Deb, yeah.
Other questions regarding the decision packages?
So you're gonna be losing 3 people in your office?
2 retirements?
Mm-hmm. And our office generalist is moving out of state.
Wow.
A lot of history.
I know, that's,
Marie and Diane, I can't believe it.
I know, neither can we.
I bet.
Who'd wanna leave this?
Exactly.
You know, we keep marching on, doing the best we can to serve clients, and doing by the right thing by the clients in the past has always led us to having the money to do what we needed to do. So that's kind of the basic assumption of if we do the right things, that money and the outcomes will come, and, yeah. I can't go down that path of being depressed with this, otherwise I can't come and manage those numbers. I have to have a little bit of hope, so, yeah. And as Annie said, this is what it was back, let's see, we would have put this back together in like September, October to run it through our, the regional governing board and to prep it for you guys today. And so, just in that time, we've had some changes. And, you know, that's kind of the way BHDS and works, of we're always walking on marbles and, do the best we can, so, yeah.
All right, we'll quickly go through our recent accomplishments. I don't really want to read all these to you guys, so I assume you've reviewed them. Do you have any questions over?
We've
Well,
worked a
great
lot-
work on the group homes. I mean, I think that was a huge accomplishment this year, obviously. That was a big one.
Yeah.
And then, just all the work that you guys have done to get where we are today.
You know, my compliments as well. It's just amazing what you've tackled this year and struggled through with the group homes and everything else. Congratulations.
But looks like we got a lot more to do.
We do, yes.
Yeah.
So our upcoming opportunities, we would like to add another IRSH home, the intensive residential, at some point. But we'll wait and see what happens with our funding and with, if we're even gonna have them under us anymore, no idea. Hiring the network provider, DSP social worker, we'll keep that on hold until we know more. And then, our outpatient competency restoration program that the state insisted that we do will be, the contract will be coming to the regional governing board and the board of supervisors in February. And we hope to have that off the ground as a soft launch in hopefully March, but if not April, to start that program. CJCC, we have a coordinator now who has been working hard on bylaws and starting some subcommittees, so we'll have our first meeting this month. So we're looking forward to that. And we are constantly monitoring our expenses and our budget because of the incentive funds and how we have to report back to the state. So always on top of that. We are really looking forward to fall of '24 to open our sobering center, the new crisis observation center, and the behavioral health urgent care at 1914 Carpenter. And then we will continue to advocate for our workforce stability and trying to work on making apprenticeships available for direct support professionals. I've been working with the state on that. We are trying to enhance some of our community support services through our paramedicine. Hopefully we can partner with Des Moines Fire on that, along with our children, families, and doing assistive outpatient treatment. And then we're working on developing a web page and a dashboard for the CJCC so that the statistics can be available at a glance versus having to wait till the next meeting. So lots of stuff happening in our future. And I think that's the last slide.
So you are approving all her recommendations?
Yeah, I mean, have to use for wash.
Pre-trial?
What's the contract issue?
Right. Okay, and that's all this about the realignment, and aren't we gonna hold off on all that until we know?
I'll need to hire some positions for the retirement, like.
Yeah.
But, yeah, other things we're gonna hold off on.
Got it. Okay, once again, you guys do awesome work.
Thank you.
We need you. Thank you for everything you do. All right. Mary Wells, Polk County Treasurer, you're up.
Oh, sorry about that.
Our estimated revenue, 50.5 million, we have some increases due to the additional earnings from investment accounts. Our expenses are going to increase a little bit, from what we requested, and that's due to our decision packets that we have, and that's going to be based on some postal increases.
Still went off there. So when we talk about our revenue estimates, we have an increase of about $4 million. And these are, again, an increase based on our interest earnings. It's been very good this year. And we anticipate that continuing on for this fiscal year. We do have some other additional income based on some legislative changes in our mailing. We went from $3 to $5, so we're increasing that by $2. So that's going to be $174,000 that we're estimating that increase would be. And we do have a decrease that we are going to lose revenue, but we're basically not losing that revenue, and that's coming from tax sale registrations. Since going to our online processing for tax sale registrations, it no longer requires our staff to take care of those, the registration process, since everything went online, so now we don't have to have that expense. And over to our expense increases, we're looking at about $516,000 on that, and that's going through some of the wage increases that, you know, when that increases, we don't have a whole lot of control over that. But we do have some bank charges that we're looking to increase, and those are based on custodial fees that we were paying. We have had the same custodial fees using that account for over the past 20 years, and so they have finally decided that it's time to increase those expenses. And so with them increasing those expenses, we did do an RFI to see, you know, are we in line with what they're asking, and some of the proposals that we got back were quite extensive, and so we are doing very well with only having to increase our first year $7,500. Next year, $10K, third year is going to be $12,500. So, and compared to some of the other custodial fees where they wanted to charge us in excess of $100,000. So I think this is a very good deal that we've got there. And on our decision package for postage and mail, we can't control when postal rates increase, but we do have to be prepared because we do have mailings that go out throughout the year. So the postal increase, it's going up about 3% this time, and we're expected to have another increase in July. We don't know what that is, so we have budgeted enough to cover us for our mailings for our plates and letters. Questions so far? Well, we'll move on to accomplishments. So some of our recent accomplishments, we went into January 1st of 2023. We did go to appointment only, which was the best thing I think that we have done with the Treasurer's Office. This did eliminate the wait times. It drove that wait time down to, for a full year, on average about 24 minutes and 35 seconds. And these are pretty much what the walk-ins, when we have our appointments, those folks are seen within about 5 minutes of their appointment time. This did allow us to see more customers this year. We saw over 8,837 more customers with this change. We did implement Qualtrics this year for our customer satisfaction survey, and that has shown that we are, when we're asking for survey results from a lot of the folks that are coming in by phone and in person, they are giving us a rating of excellent or very good, and that's 92.4%, and I think that that's very good. We did complete our transition from Bank of America to JP Morgan Chase this year. Again, there were some savings that we will realize there with that change. Our marketing campaign has increased folks to go online by 4.5%. So we're realizing more money on the property side, collecting that a lot faster. And we are also getting the vehicle transactions done more timely with folks going online. We're going to continue to push that because when they go online, that means we don't have to have as many people to be in the windows. We implemented the new WebEx contact center, and that is helping us to serve the customers by phone a lot more efficiently with the information that's there. We're also being able to collect more data as far as what needs are, so that we can respond better to the customers that are contacting us. Well, on our ITAP website, we did launch a new version to improve the online experience for those folks that are online. And we are, again, just continuing to get positive reviews about the changes that we've made for customers. And we're taking that information and making those changes based on what the employees have brought to us, as well as what customer feedback has been. We did increase our staff. We do have a need in the treasurer's office. There are a lot of languages that are in Polk County when folks are coming to be serviced, and we want to do our best to assist them. So we have been able to increase bilingual staff by 100%. So we want to continue to do that if at all possible. And last, with the UKG bidding, we were able to put a new system in place that made it a lot faster for folks to understand and know what their time off can be, and when that's going to be processed. It was a total manual process that took a lot of time. We can get this done now in just a couple of days.
Is that throughout the county, or is that something you've got?
That's something we have. I think it's available throughout the county, but it's something that we asked for.
That IT helped you with, or?
Yes. And when they put the UKG system together, we let them know how we need to do it. So it's got the seniority in there. It's got where when people are picking, it'll let you know who's picked that time already, so that you don't have that overlap, and people can still have time selected. And it's not a long time where we got to wait for this person to get done and that person to get done. They know right away if they got the time or they didn't get the time.
Okay.
It's been very beneficial.
When you say bilingual, is it basically Spanish?
Basically Spanish. We have Spanish, we have Bosnian, we have Thai, and Laotian. So we've got a few different languages where folks can speak. And some of our new systems, our new queuing system that we just put in place, or that we're putting together right now, it's going to allow folks to be able to select their language and also be able to get their information in their language. So we're working to be more bilingual so customers can feel they can get their questions answered properly, and they are able to know what they're coming in to help them with their transactions. So upcoming opportunities, we are still doing some more changes on ITAT, so we want to make sure that individuals can do reoccurring payments and have their own accounts. So a lot of folks have multiple vehicles, so they can just go to their account and they're able to select when their vehicles are. We'll be able to let them hold credit information so they can payments, reminders. It'll just be a lot more easier for folks to be able to get that their accounts done, and hopefully that will reduce the number of folks that come in at the last minute to make payments because they need their stickers right away. We are doing new point of service equipment. Those are getting installed here as we speak. We have a few of them in, and those are coming in. And these are, they're kind of almost like the touchless systems when you go to the store to make payments with credit card and with debit card. So we're getting those new systems in place and how folks can pay. And the queue flow system, which I talked a little bit about, that is coming. We are in the requirements building stage. We should be able to launch in February, and with that new queuing system, the Queuematic we've had over 20 years, it's served its time, it's served its purpose, but we need to get to something more efficient where we can make PA announcements. When the DOT system goes down, we have to get out there and yell and tell people the system's down, so we'll be able to make announcements. We'll be able to do things in different languages for folks. So it's just going to be a positive experience all the way around to make sure we can get folks in and out of the treasurer's office as quickly as possible to get their business conducted. We also are going to be doing an RFP on our tax statements this year for printing. Right now, we're printing on colored paper, which is a little bit more expensive, and we want to be able to not do that process and to realize some of the real estate that we have on those papers. So we're going to redesign that and see if we can get a better deal on printing those, and those just go out annually. We also have a system we're working with IT where we're automating the customer templates. So right now, if we have someone that we have to send documentation back to, it's pretty much a manual process. We have to create these letters to send back out. IT is working with us where it's kind of a drop and drag. You drop it down, it only prints the information you need, and then it goes out to that individual, and they only see what pertains to them. Today, it's a lot of information. They got to read through and see where we've checked the box to see exactly what it is, and it can be a little bit confusing. So we want to have a better experience for them, and so that customer correspondence template will be done here this first quarter. We're working with IT. And then we did get the website translated to Spanish, but we have been working with IT. For some reason, it's not working. It continues to not work. So we're working with the IT, with Adam Dreyer, to make sure that that change stays in place, so when folks go onto the website, they can toggle back before English and Spanish and be able to get information to make sure they have the proper documentation and understanding of what they need to do to conduct business with the Treasurer's Office. So those are upcoming opportunities, short-term, long-term. We still are we're in line for our reorganization in the back office, so each employee has their own desk. It helps out health-wise, it helps out with them having ownership of where they're at and what they're doing. It's a great deal. We also want to do front-end scanning for title work, so when items come in, sometimes they get lost moving from desk to desk. If we're able to get those scanned in right when they come through the door, then if something goes missing, we already have the copy and the documentation of that, and it'll just be a great improvement on that. And the other thing is implementing a scanning process for our transition from physical records to electronic records. We've been doing that since I've been here, and we're going to continue that process to make sure we've got documents scanned and archived properly so that we are making sure that when it's time to remove those documents based on retention, where they're out of the way, and it's just not such a manual process. And then we're also looking at doing some implementation of hybrid work schedules. We're looking at one of the things where we're seeing loss with the Treasurer's Office is people that are able to work from home. So if there's some way we can have some options where, like in the call center, they're able to work from home, we want to try to look at some of those opportunities that's been requested by some of our employees. So those are some of the upcoming opportunities that we're looking at and we want to implement. Any questions?
I don't have any.
I've got a few. First of all, Deb, I just need to understand from a budgeting standpoint, from all the different departments of county government, so all of them have the line item for personal services. So, the base wage, clearly, you don't get in the weeds as much on, department-wide, whether it's the treasurer's office, whoever it is, what step or what step of the pay schedule that they have, I mean, you do. Okay, so you know. But you know where they're at in the pay schedule. So then you plan ahead for the budget year based on where they're at on the pay schedule. Let's say they're at step 4, step 5, whatever they may be, right? Yep. Okay, so what happens to that additional revenue when they don't stay? Where's that money go?
So, twice a year, we adjust the budget. We do the first quarter amendment and the third quarter amendment. We adjust to the actuals, so whatever is that, the
Good, okay.
workforce at that point in time, we
Okay.
adjust the appropriation accordingly.
Okay, perfect. I needed to know that. The reason I ask is Mary, that I'm reading some documents here that I asked for from Human Resources about significant turnover in your office. It's significantly higher than anywhere in county government. And it looks to be, and you can answer this or not, it looks to be mostly all universal cashiers. You've had 9 of them that have left. The total separations, 46% of them left within the first year. Your average longevity for a universal cashier in 2019 was 8 years of longevity. The universal cashier now, the longevity is less than 3 years. So it seems that you have a lot of turnover at the universal cashier position, more significant than it ever was 4 years ago. Do you know why that would be?
Yeah, there's been changes. One of the changes is we've got, let me just say this. It is a entry-level position. And in that entry-level position, it is paid at what I would say is less for what we're asking those folks to do. Those folks are asked to do quite a bit. They're in the windows, they're doing the lien department, they're doing phone service. So it's a lot. And when they're coming in and they're not having the proper training, and that's why we have a trainer to increase that training to get better understanding of what their jobs and their role are, it was difficult. And so we have fixed the training issue, but it is a very complicated and difficult job to understand. When those individuals have to know the information for this, for Iowa, as well as the other states, it's a lot of information for what we're asking them to do. And I think that the title of that job, universal cashier, is very misleading. If you were to say, when you're looking for this job as universal cashier, most people think something different, and we try to make sure we're very clear when we're interviewing these individuals so they understand what this job actually is. It's a customer support position.
So has it changed significantly, the job responsibilities since 2019, when longevity was at least 8 years of service in your office, to now when it's less than 3, actually it's 2.88 years? What's changed since 2019 in that position that you can't keep anybody there and they seem to leave within the first year?
I would say that it's a very difficult job, and it's just changed after
Different now
COVID.
than it was in 2019?
I think it's a difficult job, period. It's always been a difficult job,
Okay.
based on what I'm hearing from the staff. It's always been very difficult. There's always been a lot of overtime in that job. We've eliminated a lot of those things. And I think that we have, with the longevity, we did have people that did retire out as well in those positions too. But it's just it's a difficult job. I'm not going to say it's not.
I don't have any other questions based on that. I am concerned about the significant turnover in your office, but it's your office, so. The other thing I would say, based on your comments, and we just had a discussion at the board level about this yesterday, a little bit of a discussion about it. And I can only speak for myself. I can't speak for the rest of the board members. But I think this whole working from home issue has gotten completely out of hand. I know it's a recruiting tool. I understand that we use it as a recruiting tool. So someone comes and applies for a job and basically says, I want to work here, but I really don't want to come to work. If I can just stay home and I can get a paycheck and do some work from home, I struggle with that whole concept. It all started during COVID, and it's even amplified now. All over county government, there's people, you can go into offices right now, that there's 2 or 3 desks with people at them, and the rest of them are empty because it's their day that they don't come to the office or what have you. I wasn't raised that way. I know you weren't. When you had a job, we want your job, right? So this whole idea about working from home is just not my cup of tea. I think if you want a job, then you need to come to work. We need to have people at the office. This is the public sector. When taxpayers come in here, they expect people to be able to be here and respond to it. Equipment operators don't get a chance to stay home. Detention officers don't get a chance to stay home. So it's just not a fair system. That's just my concept on the whole working from home issue, as you continue to go down that path.
Well, I'm looking at it because that's my last losses were because they have that opportunity to work from home, and that's what I'm hearing from staff. And I'm trying to keep my staff happy that's there, and so there's an opportunity where I can have some flexibility to make sure I can maintain staff. I want to work and do that.
That's what everybody wants to do, apparently.
Unfortunately, I get it. Yeah, we can't have very many of that because we are a face-to-face organization. So the only place we have an opportunity to be able to do that would be on the phones.
Right, and then you get your other staff that do have to be there every day, say, wait a minute, I gotta come in here every day, and this person over here comes in here 3 days a week, or 2 days a week, or whatever it may be.
It's a juggling act. We got to find the right thing and see if it works. Sometimes we've got to continue to make changes, as we've done, to make accommodations so that we can maintain staff and keep people in place and keep them able to do their job. It's not an easy job in that universal cashier position.
It's just a sad state we've gotten to, Mary, not only in your office, but across county government, where people just, they want to be able to stay home. And I
Yeah.
get it.
Everywhere.
I get it. Yeah,
Everywhere.
I know it's
Yeah.
all over the
Yeah,
private sector.
you're right.
Yeah, private sector, same thing. Okay.
Yes, go ahead.
Just want to draw your attention, since we're all here. Sarah and I met with the Wells Fargo Event Center team yesterday. The remodel of the IHOP, we had architectural projections on cost. You originally approved 7.5 for all the changes for rehabbing IHOP and those adjacent facilities. So the bids have come in, no surprise, significantly higher than they
Of
anticipated.
course they did.
And I will give Chris and his staff credit, they really looked at whether they could trim this back down. So we've got it in a position now where it would probably be, what, 120,000 over that 7.5, with the actual bids coming in. But that would, and that's after they trim back a lot of stuff. You know, things like going from some wood-based vinyl to, wood-based floors to vinyl. So they've reduced it where they were comfortable with those reductions. There was one reduction I think I would encourage us to put back in. Remember that, all that woodwork is in there, and they wanted to redesign that. It was really an attractive piece. That wasn't in one of their cuts. I'd recommend we put that back in, which would put it around 140 to 150 over what you have approved. The other big change was they wanted to do significant lighting changes in that old space as they refurbish it. That's about a $360,000 cost. Sarah and I think we recommend that we plug that into the upgrades that we're gonna need to do in a couple years, once the bond is paid off, or the funding for Wells Fargo. And we know we've got about $15 or $20 million of just modernization.
So the lights work and they're fine.
Lighting in the new ballroom, that's the lighting in Hy-Vee Hall, so
Right.
they'll use the ballroom and the breakout space will be Hy-Vee Hall, so they're refreshing like the carpet and paint and like all that stuff in the Hy-Vee Hall conference room. And we're proposing, and it was $390 if the lights work, to just hold on the lighting. They said that it won't be a big deal at all, we can do that in a couple years.
Fine.
So we looked over what they said. Our recommendations would not do that new, really high-tech lighting until the other upgrades take place, but we would recommend that we do about 140 to 150 over what you have already approved to get the stuff done that we think.
So that's about a 2% increase over the original then?
Pardon?
It's about a 2% increase over the original then?
I guess that you're doing better math in your head than I am, Bob, but that's probably right, yeah.
It's kind of a victory if it's only 2%. I mean, I thought you could come back and say it's $1 million more or something like
It
that.
could have been.
I
Could've
would
been,
add
yeah.
the first round of, like, the first time I saw the budget, it was over by about $500,000. They scaled that back to exactly 7.5. And when it went out to bid, we got back up to $500,000 over. So this is their second round of scaling back, making it really close.
You have anything left, Sarah?
Huh?
Is there anything gonna be left? All of that shell down there?
Yeah, I mean, and this isn't a critique of them all. You make estimates based on moment in time. Now, when the bids came in, they worked to get that $500,000 back down, and our recommendation is you probably need to do about 140, 150 over what you approved. So we'll check and see if we need to do a resolution on it, but I wanted to give you a heads up. And if anyone wants to see the items they've changed or cut, I'll circulate this copy to you.
Elevator still in there? Is the elevator still in there?
Elevator's separate from all this. We're bonding for the elevator, and they're working on resolving what the best elevator solution is. But they felt comfortable about the outcome there.
We need that.
We approved, so it's a freight elevator, and we approved the project, it was $1.2 million, so $1.5 million bonding cap, and it would be a new freight elevator and a passenger elevator as backup. They wanted the really expensive one to be 2 freight elevators, so we went with freight elevator and passenger elevator. They're running into some issues with the bathrooms, having to be moved, so still waiting to see if we'll be able to do both of that and standard 1.5.
Okay. So once that gets hashed out, are we gonna go out for bid here soon? Is that next here coming up soon? Bid, going out to bid?
The numbers were based on bids, so.
So we're ready to start working? Okay, sweet. Okay. All right. Thank you, Mary.
Okay.
Sorry, we had to go sign off here on this other deal, but
All right.
anything else from the board?
We digress.
Okay, nothing else. Do we have a meeting tomorrow? No board staff? All right, you can all take the day off.
Yeah, by all means, everybody.
You're funny. Sarah, really,
Yeah,
really funny.
go home, watch Netflix.
Stoke the fire, why don't you? I know it.